This is Dr. Victor again, bringing you the second highlight, that is Dabigatran versus Warfarin on cognitive outcomes in non-valvular atrial fibrillation, the results of GIRAF trial presented at the American Heart Association 2021 scientific sessions. The GIRAF trial was created with a multicenter randomized prospective parallel active control blinded design and conducted in 6 centers in Brazil. The trial assessed multiple cognitive outcomes in cohort of patients randomized to 110 or 150 milligrams of dabigatran twice daily or once daily of warfarin. The trial enrolled and randomized 200 patients. For inclusions in the trial, patients needed to have a confirmed atrial fibrillation or atrial flutter, a CHA2DS2-VASc score greater than 1, and be aged 70 years or older. The exclusion criteria for the trial included a history of valvular heart disease, previous stroke, dementia, or any severe neurological or psychiatric disease, major recent surgery, recent bleeding events, active cancer, warfarin, contraindication, a creatinine clearance of less than 30, active liver disease, or a left ventricular ejection fraction below 35%. The cognitive function assessment occurred at 1 and 2 years of follow-up visit. Specific function assessment used in the study include MMSE, MoCA, Geriatric Depression Scale, Semantics Verbal Fluency, Phonemic Verbal Fluency, Digital Symbol Substitution Test, Boston Naming Test short version, and Clock Drawing Test. Participants also underwent a brain MRI at baseline and after 2 years to identify potential cerebrovascular events. Upon analysis, 2 years' result suggested there was less than a half-point difference between the warfarin and dabigatran group in assessment of memory, executive functions, language, and attention from baseline. But investigators noted these differences were not statistically significant. A statistically significant difference was observed for differences in the MoCA score between the two groups, with a mean difference in change of minus 0.96, with the 0.02 p-value of significance, thus favoring warfarin. Investigators also pointed out that no participants were diagnosed with dementia during the follow-up period. Thus, there was no significant difference in the majority of cognitive outcomes with warfarin or dabigatran at 2 years. Doctors, as we know, cognitive aspects are important for patients with atrial fibrillation, and these results will help guide the decision about which oral anticoagulation medication should be prescribed. Further studies are needed to explore new concepts on potential prevention of cognitive decline and the possible benefits of treatment of patients with atrial fibrillation and their families. Thank you.